Dr. Craig Kubik, thank you once again for coming and speaking. You're a popular lecturer. Everyone enjoys it. You're down to earth. You're clinical. It really makes sense. Tell everyone about your practice, if you don't mind.
Well, I'm in private practice in Waycross, Georgia, with my partner Sohail Chowdhury. This is my 20-year anniversary in being in Waycross.
Wow. Well, I know that community appreciates you, I'm sure.
Well, they got used to me anyway.
Well, your talk today, I don't remember the exact title, but it was about basically fatty liver and NASH, non-alcoholic steatohepatitis. Maybe you can tell people who are watching this how to differentiate and what the importance of that is, if you don't mind.
Well, fatty liver has been with us for a while, but it's becoming more and more common, mostly because the population is just getting larger. Obesity is getting more common in the U.S. and across the world, and so liver is getting more fatty, along with just the person's total body habitus. And what's more dangerous or more serious than that is that fat can be ignited, you might say, and we're going from just steatosis, which is fat in the liver, to a steatohepatitis, where there's actual inflammation. And because of that, fibrosis is laid down, there's scarring in the liver, and that ultimately can end in cirrhosis. And cirrhosis, many people think it's just that it's from alcohol, but there are many other reasons for cirrhosis. This is becoming the most common reason. We've got a good handle on treating and curing hepatitis C now. People are maybe drinking a bit less, except as we were talking about, young women seem to be drinking more, and that's not a good thing, because women's bodies just don't handle alcohol as well, and they're much more prone to liver damage, just even drinking two alcoholic drinks a day. So that was just a little sidelight of the talk. Is women especially, everybody has to be careful how much alcohol they drink, but women especially young women. And there are no drugs approved for fatty liver steatohepatitis right now. So what we're left with is if you're overweight, get your weight down. You need to lose weight, diet, exercise. If you have diabetes, control your blood sugar, which oftentimes goes along with losing weight.
Sure.
Moderate alcohol intake, if that's not part of NASH, but it's a part of liver disease. There are some drugs that might come to market. The FDA may approve, but right now there's no medication, so we're left with lifestyle change, which is easy to talk about and hard to get people to do, right? But it's a serious problem for younger people under 50. NASH leading to cirrhosis has become the most common reason for liver transplantation. So they're developing cirrhosis, the liver is failing, and transplantation is necessary. So it's a big problem. As we were talking about, there's just been a national NASH Day, right? So it's a big deal. And in Germany, they're going to have a whole conference on fatty liver and NASH. And so, it's a big deal across the world and a big health problem, public health problem.
So if the doctor sees some fatty liver, how's he going to know if it's NASH? Is there what kind of things are going to clue him into NASH?
Oftentimes, the person is going to come in with elevated transaminases, AST and ALT, and that will lead to an ultrasound, which will show a fatty liver. Or sometimes an ultrasound is done for some other reason, and a fatty liver is seen, and then liver function tests are drawn. So, but you don't know if there's NASH, if there's inflammation, and just trying to draw the conclusion, well, if the liver enzymes are high, maybe that's NASH, it doesn't work. So previously we were left with, well, we don't know unless we do a liver biopsy, taking a piece of liver tissue, but that's invasive, there's some risk and some discomfort and cost to it. Now there's some non-invasive tests done with the ultrasound or the MRI machine where you can actually get a sense of liver stiffness. And with the MRI, even get a sense of liver inflammation. So it looks like once this becomes more readily available, we'll be able to move beyond just saying, well, you have a fatty liver, maybe you have the steatohepatitis, to actually being able to show the person, here's what's going on, this is a serious problem in your case, it's just not theoretical, and you need to move on it, you need to lose weight. I think at some point, if smokers knew they were going to get lung cancer, maybe they wouldn't smoke, but everybody, it's human nature to think, well, it won't be me.
Sure.
I think it's the same thing with fatty liver. It's like, well, yes, some people get chronic liver disease, but I probably won't. But if you could show them the MRI, and that shows this is what's happening to you, and this is what's happening to your liver, you need to change your ways, could be more could be more helpful, or could be more persuasive to them.
Absolutely. Well, once again, thanks again for talking to Rome Southeast. We appreciate you.
Well, I enjoyed it. Thank you.